Eu queria a apresentação, por favor. Ou sou eu que passo? Já está aí. Boa tarde a todos. Gostaria de agradecer.
I'd like to thank for the invite to be here, sharing with you my most important challenge is to say everything that I have to say in 8 minutes, talking about a public policy that we have in the state of Pernambuco. We have PIN in Rio Grande do Sul. In Pernambuco, we have a totally different reality. And for those who don't know, Pernambuco is up in the northeast of Brazil in a situation of adversity, very different from other regions. So we have this challenge of being a continental country with so many inequalities, so many different challenges. So we have a state with more than 8,700,000 inhabitants, with a university and a very important inequality in the state. Mother O is the name of the project. The owl is the only bird that can see in 360 degrees. And this is the philosophy of our program. It's related to knowledge of those who want to gather the parts to see the whole picture. The objective of the program, in 2007, we carried out a study. When we were in the administration, we carried out a study of all the indicators, and we saw that some regions had a very important inequality. So we needed a program that would better take care of the coming up generation to reduce infant mortality. So the chances of a child being born and living in the capital was totally different from being born and living in the countryside, in the sertão. So the great challenge we had, today we have the program in 105 municipalities. And we have 2 applications of the model in Recife and in Pojuca. All the legal framework is here. It's a state policy. It's actually a law ever since 2009. We have a good organizational structure with a central level, monitored by the state governor, where we have the main priorities, and we have monitoring every month. We have 9 state secretariats participating in the program. At the regional level, we have the executive committee. I'm the coordinator of such committee. At the regional level, we have 1 committee for each region in the state, replicating these regional partners. So in each municipality, we have a center for the program with management and monitoring. And we have 3 axes: education, social development, and health. 9 different secretariats, each one with a different scope of responsibility. Coruja is a policy driver. It tries to put a patch in the fragile aspects of public policies. We have some additional aspects in education. For example, we work to empower women, which will help literacy and bringing children back to work, dropout children. We have in Pernambuco a number of children who are not registered, so we deployed this program to register children at the maternity, and then we have prenatal follow-up and all other important actions for health. We have the Agricultural Secretariat to help the farmers, women farmers in the city. We have the Labor Secretariat also improving the income. Planning Secretariat is responsible for monitoring and planning. And an important aspect of this program is that women in this program, both in Coruja and also in other programs, we have a system of information where we can register all the women biopsychosocially. Each secretariat is seen online, so we can see the needs and the rights of each woman. We have access to this data so that we can intervene in real time and keep track of what's happening. So if there's a child that hasn't been vaccinated, we know where this child is, who this child is, and we monitor and we make sure this child is vaccinated. So we have the governance, we have the governmental level with absolute priority. We have the different secretariats, and we have local and state management and the region where this all happened. The great strength of this program is that it empowers the local partners. We build alliances from the universities to the civil societies. We are in contact with a health network, educational network. This is a model of the strategy map. I said it was almost impossible to say everything that I wanted to say in such a short period of time. The map is a priority view. This is the information system. So we keep track of what's happening. We can have immediate response for all the municipalities. We have monitoring of the process and evaluation of the process. This is the team. We say that a program may be good, but if people don't really buy in, if we don't have the political power, it won't happen. So something that we were very concerned about ever since the launching of the program was the belonging of each one of these people. So in spite of the change in administration, the program will be universal, will be universalized. At each level, at each different level, we have all the different processes. We know what everybody's role in the program is. In terms of governance, we have political, very important factors, so we have political strength. We have a model for management and monitoring at all levels. We have a lot of investments in human capital, human resources, technology serving human capital. So we have a very good information system which allows us to see the needs, and we can make faster interventions. We can see the needs, and we never cut, our budget can never be cut, and the political aspects.
And Pernambuco has been able to reduce infant mortality. We made a huge investment in development in these last few years, in 8 years. And in Brazil, there has been a reduction in infant mortality. However, the rate of reduction in Pernambuco was greater than anywhere else. When we did the studies on infant mortality, we saw that those municipalities where Mãe Coruja is present had a very, very important role in decreasing infant mortality. So my time is up, and I remain available to take any questions you might have. This is a map of Pernambuco and showing the infant mortality rate, and only 4 municipalities have today rates above a certain level. We have to think that we think about where to go next. We are now working in childhood development. We have designed a plan with our partners, and this year we worked on the Chilean model, and we want to work now on early childhood development. And with this, in Pernambuco, we are building a new history, new life for everybody and for us as well.